Take a look at just what those statistics are in our explainer tonight, understanding where we are. Now, what we would like to do, first of all, is just talk about and reiterate what you've just seen in Wahiga Mara's story. Over the last 24 hours, 21 people have lost their lives, the highest number recorded in a 24-hour period to date since the coronavirus was first recorded in the country. Now, remember they said that October was the deadliest month, and we'll get to those statistics. November is shaping up to be even deadlier. So we did a comparison of the first 5 days of November and then put that together with the first 5 days of October. So October 1 to the 5th, the total number of deaths in the first 5 days of October was at 24. If you thought October was the deadliest month when it comes to COVID in the country, think again, because the first 5 days of November are proving to be even worse. We're recording double digits of deaths every day from the first day of November, meaning as of the first 5 days of November, we're at 76 deaths. And at this time in October, we were at 24. That's close to 3 times the number of deaths. And so if things carry on the way they are, this is a very worrying trend so far for the month of November. And of course, this is why the president is concerned, and so are all the other authorities, including those in the Ministry of Health. And in fact, in that extraordinary summit, the president said things are not going the way they should. And this is what he had to say.
But after de-escalating the measures at the end of September, we as Kenyans seem to have backtracked from the practices that we learned in the early stages of this pandemic. And all of this built around the false notion that because the curve was flattening, the country was now safe.
And yes, the president is right. The curve was flattening. So again, what I did was just taking a look at some COVID-19 statistics. This is particularly to do with the number of infections, the total number of infections that were recorded month on month from August through to October, right? Was the curve flattening? It was. In the month of August of this year, a total of 13,265 cases were recorded in that month. As we have heard, we were more vigilant with many of the safety protocols that had been put in place. But in fact, that is what prompted the president to say, well, you know what, let us start to ease some of the restrictions. And we saw that in July, I believe on the 6th, and then again another 21 days later. Things were looking good. So total number of infections in the month of August at 13,265. Take a look at what happens in September. We're doing really well with all of that. Remember, at this point, the public rallies were not too many. Schools had not been reopened. We went down to a whopping 4,328 total infections recorded for the month of September. What happened in September? Well, towards the end of that month, that is on the 28th, the president further eased quite a few of the restrictions. The prohibition on alcohol was lifted. Bars and restaurants were allowed, in fact, to operate later hours. The curfew was moved up to 11 p.m. And later on, a few weeks later, schools reopened. By this time, of course, remember, the inter-county restrictions had been lifted. What happened in a month? All of the gains that had been made in the month of September were lost. In fact, the total number of infections recorded in the month of October surpassing that of August. We were now at 16,603 total infections recorded for the month of October. This was the highest number of infections recorded in 1 month since we started recording cases in the country in March. It was also the deadliest month, and this is why. If you take a look at the number of deaths, this is where we were. In August, we were at 236, and corresponding with the reduction of the number of cases that were reported, here we had 134 deaths total for the month of September. And then take a look at what happened here. We had 289 deaths. Now, at the time, it was about, this totals about 26% of the total deaths in the country so far in just 1 month alone. Point to note, at this point in September, our infectivity rate, our positivity rate was at 4%. By October, we were back up to the double digits. 12 to 15% on average. So this is where we are if you compare what's happening in August, in September and October, and that will help you understand why the President introduced or reintroduced some of the measures that had been lifted previously. Now, if you just take a look at the general statistics in the country, where are we with that? This is an important thing because this is what demonstrates that this is well and truly within the population. 98% of the total cases that have been reported are due to local transmission. The era of all of these cases coming from abroad is long gone. Here is something else. You do not know who has it and who doesn't based on the symptoms. Out of all the cases that are reported in the country, only 7% are symptomatic, and the most predominant symptoms are the cough at 52% and the fever at 36%. This essentially means 93% of the cases are asymptomatic or not showing any symptoms. That means you don't know who has it and you don't know who does, which is why we're talking about extra vigilance on our part, and indeed as well of the political class with the rallies, the President acknowledging the same as well. This is something that continues to confound statisticians and epidemiologists in this field. Over 65% of the cases are male. Now, there's a lot of controversy around this, but scientists are yet to confirm why exactly more males are affected by this, and naturally because more of them are infected, then the number of deaths, and this is in the country, are more in men. That's over 70% of all deaths in the country. That's the 1,072. Over 70% of those are male in the country. Folks, we are not in a good place. And if you take a look at the restrictions that have been put in place, this is just what it means, right? So the curfew that is now from 10 p.m. to 4 a.m. has been extended all the way until the 3rd of January. So picture this. Christmas celebrations will be happening mostly indoors. The overnight celebrations or overnight keshas that we're used to on the 31st of December will also be happening under these tight restrictions. Remember, eateries and bars will be closing an hour earlier at 9 p.m. So that is what we're looking at over the next couple of days, weeks, and months. That is 2 to be precise. But do note that where we are with November right now, if nothing changes, if our behavior doesn't change, if the politicians don't change, the leaders don't change, government doesn't put in place issues to do with the hospitals, we could be staring at an even deadlier November. So that is the case with COVID-19 in the country. And that's our explainer tonight.